Hi, good afternoon. It's 1:30 p.m. here in Dubai, just an hour before I leave for my clinic. Update. I finished my 1 hour of my session of personal training, keeping up my words that I'll be continuing to do at least 30 minutes of some form of workout with you all until your September exam for my enrolled candidates. The mentor is in with you. And let's solve one of the other Australian exam SBQs quickly. Uh, yeah, night was okay because, see, we shifted in this home like 2 years ago, and this building is like 15 years old. So the geyser, the water heater basically, that gave up. And my husband was also traveling to Saudi, he wasn't at home. So the water started leaking, and I was like 9:30 p.m. at night. What am I supposed to do? Call the technician. That is one advantage in buildings. You can get the technicians easily. So he just came and closed the valve, and I still have to get that repaired. So yeah, unexpected things basically keep happening, and you just have to maintain your calm and you like deal with it. So yeah, deal with that right now. It's not a big deal at all. Just letting you know what happens in my life, a normal human being staying by yourself. I remember when these things used to happen in my Mumbai home. Mama, Papa used to take care, like I'm least for it. I'm like, okay, Mama's getting this repaired. Papa is calling somebody. I'm busy with my studies or friends and blah blah. Now when it comes on your head, yeah, you gotta get things done. Yeah, let's move on to the question at hand and finish it off. It's a nice question, and you will face this scenario. I don't know in your exam or not, but in your clinical life, 100%. So, a fit and healthy 32-year-old female executive attends your practice as an emergency patient. Emergency patient. She's distressed, having broken her upper anterior tooth, which is a post crown. Okay, and the post has fractured. So the question is very clear. She has a tooth, there is a post inside it, and there is a crown over it, and it's the post that has fractured. So basically, the crown along with the post has come out, the root is still inside. She has an important meeting, and following day, she has an important meeting the following day. That is the day after, and is extremely distressed. That's why she came as an emergency patient, and she is very keen to keep the root. How will you manage this case? Okay, so she is a 32-year-old female executive, basically a professional, and she has to go to work, and it's very understandable if it's with the front tooth and it's just in your hand, how weird it's gonna look. So of course you can understand the distressing part as she has to attend a meeting. But she is also very clear that the root which is inside has to stay there, which means that whatever your treatment you have to do, it should be like the least priority should be of removing that root. Basically, that is what this means. Now, to proceed with this question, I know all of you all know what a post and core is, but just to brush up a bit, especially for those just recently passed out graduates or people who are in internship who have never done this, seen this. What does this mean? See, tooth. Whenever, yeah, you can see this picture. This white thing, that's a post. This structure inside which this post is going is the root, and this cement buildup which is done is a core. And upon that core, a crown is given, which is like this. So, when the post fractures, which can happen due to various reasons, suppose the post fractured at this end, then from this part onwards, everything is out in the hand, and only this part is hanging there. Now, in such a scenario, when a patient comes like this, firstly, you have to ascertain that the root canal which was done in the post is appropriate or not. You cannot just jump in to fix everything back because you have to really make sure that there is no infection inside before you cement the remaining part of the post and core if it is cementable back, or make a new post and core and then cement it back. Because if you do that and there is some infection left inside and then some problem happens, then you will be held responsible because you became the last treating dentist on that tooth. Understand? So, the first thing as a clinician, I'm telling you, whenever a patient comes to you with a situation like this, that the post has fractured the crown and the post is in the hand and the remaining portion is in the jaw, the first thing that you will see is whether there is an infection. Okay. Next, you will ask the patient, "Well, how did it fracture?" If he says, no, it just happened, fair enough. You will take a probe and you will do a measuring around the tooth to see if there is a pocket. You're basically trying to see if the root has fractured or not. Once you're done with that, you will take an x-ray. Okay. On the x-ray, you have to see the periapical status. If everything looks okay, great. If not, then you have to deal with that thing first and then do some other temporary arrangement to give her a temporary crown, but you're not fixing anything back on that root. Then you have to tap the tooth just to see if there is any periapical response or symptom in case the x-ray is not showing anything, but the patient is experiencing it, because acute periodontitis, acute periapical infections won't show on the x-ray. Understood? After you have ascertained that everything is all right and you're able to remove that remaining part of the post which is stuck in the root, then only you proceed to make a new one. But at any given point of time, you feel that the root is gone and it cannot be saved, or there's some form of infection, or the fracture has happened, or whatsoever reason, then you'll have to be very careful in telling the patient that you cannot save that root and you cannot redo the post which was done before, which has lasted quite a while. But for temporary measures, you can probably give the patient a temporary crown over it, informing, taking the consent that this is a temporary thing which is done for an emergency purpose, because she is having a meeting but she has to come back for a definitive treatment, and that this temporary treatment is not going to stay for a long, long time. What other method you can do to replace the tooth for a temporary measure is that you can put a fiber splint, those fiber periosplints. You can put that between these two teeth and then make a crown over it using a composite, or you can use those strip crowns and then fix on it as a temporary measure again. So these are the temporary things you can do to give a tooth in that place until the patient comes back for a definitive treatment. So, having known of all these things and having a little bit of confidence in managing such a situation in case you cannot immediately refix the post and crown, let's go to the question and see what it's asking and how you're going to solve it. I hope this concept is clear. What is post, what is core, what is crown, and what is a post fracture, not a crown fracture. Understood? So, let's go. Okay, what should you do if a patient is being rude or abusive to the front desk staff? Well, this question is not that specific if it's related to this case or not, but assuming this patient came in an emergency, the reception told her that the doctor is busy and she's getting pissed off because she's distressed and she's becoming very rude and abusive. What should you do as the clinician? If it's your clinic or you're practicing in a clinic, you are the doctor of the clinic, what are you going to do about it? Apologize to the patient. Oh, I've opened the response one week. Let me go to the questions one. I don't want you all to see the answer. I want you all to think about it. So, yeah, this is how mocks look like. A lot of questions and you giving the answer, and then once you submit, you'll get the answer to it. Yeah. So the options are: apologize to the patient and give a discount. Why? First, just see what is she being rude about. Talk to the patient privately to understand their concern and try to resolve the issue. Makes sense. Defer the patient's treatment until their concerns have been addressed to their satisfaction. Call police. Why? Send the patient away. Why? Just talk. Talk privately. Tell the patient, can you come in my room? Let's just understand your concerns and let's just try to resolve that. Nobody is psycho to come and just start abusing. I mean, it may happen, but it's a very, very rare scenario. Mostly, some of the concerns of the patient may not have been addressed, which they are expecting it to be addressed, and that's why they became rude, right? So, you as a doctor first just take the patient side of story as well. Option B is my major priority. Option C, if option B was not given, then I would probably go to it. So, option B and C. Apologize to the patient and giving a discount is meaning like you are wrong. You should never do that. You should try and understand. And in case you are wrong in some scenario, then you apologize. But giving a discount is not a professional way. Best treatment according to her desire will be. Now, this is a very catchy question. You remember, if you have seen my other videos, what do I say? There are big scenarios. I'm really happy because there's so much of detail. But it's the short sentences like this which will give you troubles. One way of reading this question, if you are in a hurry, you would just read what is the best treatment, you know, and then you probably would be thinking, oh, the post and core has fractured, let's just remove the root and give an implant, etc. But the question is not asking that. The question is saying best treatment according to her desire would be her desire. Okay. Removal of the residual root and residual fractured post and restoration with a temporary partial denture. Is that a wrong option? No. But what does it say? Removal of residual root. Does the patient want residual root removal? No. Remove the fractured post and replace the post crown. Yes. Remove the removal of the residual root and residual fractured post and restoration with implant. See, this is what I meant. The implant option comes in. If you did not read that word, her desire, I'm sure a lot of people would have chosen the option C. Because they would have just focused on best treatment. Yes, indeed, the best treatment is to give an implant. But is that the best treatment for her desire? No, then option B is the answer. So just reading the key word changes your answer. So I keep on telling this. Please read each and every word properly. Sorry, I'm just burping. Please read every word carefully. It's very important. Your reading of the question is going to decide your answer, and you choosing the right answer will decide your fate in the examination. So don't jump on to answer. You know what? Even if you are not able to answer that entire paper of 70 questions in 2 hours, which is quite a lot, even if you say example, leave 5 questions unanswered because you didn't have the time or you didn't have time to think, it's all right, because you're answering the rest of the 65 questions properly instead of you jumping on to answer the 70 questions and making 20 mistakes. Getting my point? Focus on quality more than quantity. Yes, the quantity is important, but it should not be at the cost of quality. And your quality will become fast only if you solve these questions, that is the past papers, in a stipulated amount of time again and again. It's nothing but revision and training your brain to just spot the right keywords in a short duration. And that can only come with practice, nothing else. Most important next step is to check patient's aesthetic concerns, pain or infection associated with the tooth, and post type. What did I mention before the start of this question? Pain or infection, because that is the most important thing, as you cannot do something in an infected area, even if it looks a simple thing. You have to do your examination diagnosis properly, because if you do cement that post back, if it is cementable, and there is an existing periapical infection going on, which the patient has not told you about, but you will figure it out during your investigations, then you are in trouble. Understand? So, pain or infection associated with the tooth is the most important next step to check. Speaking of that, I just received a voice note in the morning by one of the candidates who's not my enrolled candidate, and it goes on like, I've joined another course, and it's just 2 months remaining in the exam. I've read all the syllabus, but I'm not confident. Darling, you have to solve the mock. If you're not going to solve the past papers, there are textbooks and textbooks on dentistry, and you can read all of them. Yes, you will become a better clinician, but you won't clear the exam. because you're not doing that. One thing which is going to be asked in exam, which is going to judge you in the exam, is you solving the questions. And questions, I have repeatedly said, are not MCQ questions. They are scenario based questions which you have to use an analytical skills, and you have not been trained to do that so far. So practice. So 2 months remaining in the exam, solve as many mocks as possible is what I'm going to say. My son came from the nursery. He can enter the room at any point of time. Upon examination of the tooth before starting the treatment, the tooth was painful on percussion. The ideal treatment is, now you are being asked as a clinician that uh, the tooth is painful on percussion, TOP positive. That means some periapical infection is going on. So, what is the ideal treatment now? See, whenever a root is having a periapical infection, hello. So yes, my son came back from nursery. They expect some disturbance, but anyways, I think we were that the tooth was painful, and so the ideal treatment of a root which is painful and there is just a root structure left and nothing else, you should be removing that. There is no point doing a re-root canal in a fractured no, in a short root, and then again going with a post and core. It's very difficult. So the ideal treatment is to remove the tooth and then give an implant. So let's see what the options are. To proceed with post and core restoration. No, that's not ideal. To give patient antibiotic and analgesics and proceed with post and core restorations. No. To proceed with post and core but don't make full crown until the tooth is relieved. No, because you're still proceeding without treating the infection. Don't make post and core. Yes, that is the right answer. You might be thinking, why shouldn't I give the patient antibiotic and analgesics and proceed? Antibiotic analgesic in any dental infection related to the tooth is just to control the symptoms, not to treat it. You know that, right? So here the treatment part is not mentioned. If there was an option which would have said that remove the root and then after healing do an implant or an FPD or an RPD, then I would have chosen that. But all the ADC options are not treating the infection. They are just telling you to proceed with post and core after so and so. The right answer here is don't make post and core because that's the ideal treatment as there is pain on percussion. Understand? So yeah. Now the last question for this SBQ is the purpose of post and core restoration is to purpose of post and core. Why do you put a post and a core? So that you can put a crown over it. So the only purpose of that post and core is to retain a crown over it. That's it. Because the short length of the root cannot retain the crown over it. The crown will come out very easily because there is no retention and resistance provided to it. But a post and core is going to provide that. And the post takes its support from the root by going it quite deep inside the root. So the purpose of post and core restoration is to seal the root canal treatment. Now, reinforce the remaining tooth structure. No, in fact, it weakens it. Retain the artificial crown. Prevent root discoloration. No, nobody cares about root discoloration. So, retain the artificial crown restoration is the answer of choice. So, what I want you to take away from this video, Mummy batayegi, 2 minutes. So, what you should take from this video is read more about post and core. Read about types of post, read about the ferrule effect, read about the J-shaped radiolucency that can happen when a root fractures, read about the different types of temporary restorations anterior you can do on an emergency basis, and try to identify the keywords and yeah, solve as many mocks as possible. Currently, we have 27 mocks, and for all the enrolled candidates with me, I think they are just in their last session of mocks. I think they must have solved majority of the mocks by now. I give a study plan, and I have to stop this video now because my son is here. Bye.